Good morning, everybody. Dr. Bhaskar Rao, CEO of KIMS Hospital, CEO and MD, KIMS Hospital. Professor Gopal Krishnan, the senior most nephrologist in the city. Dr. V.S. Reddy, head of nephrology at KIMS. The invited faculty and the chairpersons, friends, the media, people from the media, ladies and gentlemen. It's a great privilege to be with you in a very, very auspicious day for us that we completed 1,000 kidney transplant at KIMS Hospital. This is a long journey, not that we have completed in just a couple of years. I think this is since 2005 when we started the transplant program at KIMS, almost 15 years. We could complete 1,000 kidney transplant. At the beginning, the things were different and difficult also, because the transplant, many people, many patients didn't know what exactly is a transplant. We had to make them understand the quality of life after transplant, the result of transplant, the cost factor, and so many other things. But now things are much better because there's a lot of public education. Mainly through the internet, they know what about the transplant. And from mouth-to-mouth publication, because a lot of patient goes back and tell them that, yes, I have been doing well after a transplant. So any people, any person, any patient with CKD or chronic kidney disease, definitely the best treatment option is a kidney transplant. We have a very ethical transplant program. Last 15 years, we only do a first degree related transplant. We are very particular about that. Our MD is very particular. And of course, we have also developed a very vibrant disease donor program in KIMS. I think one of the most vibrant program, at least in this part of the country, is the KIMS Hospital. And we have done more than 200 kidney transplant during last maybe about 6 to 7 years or 8 years. And that itself is a good number, because if you look at the number of transplant having in different hospitals, I think 200 plus is a good number. And that is where we thought that, yes, let us share our experience with 1,000 transplant. And this particular program, we organized not really as a scientific program, because we want people to know what is exactly happening in the transplant scenario in this state. To discuss about scientific issues, we have a lot of platform, lot of meetings we have, but that is why I decided that, yes, let us talk of something else. And some of the very senior people from the city who have a lot of experience in transplant and nephrology, we have invited. And I'm very grateful to them that at least they have accepted our invitation without any hesitation, and they all came here, or they are going to come here and talk on the subject what we wanted them to talk. Little different in the sense that some of the people, of course, Dr. Girish Narayan will be coming, he will be talking about how to make transplant affordable for our common people, because Girish Narayan, I have been seeing him for the last 20 years, he always complained that transplant is very costly. So I decided that you are the person who should talk now how to reduce the cost. So he will be coming and talking about how to reduce the cost of transplant, if it is possible, without compromising on the quality of a transplant. Dr. Sonlata, there are two Sonlatas here. I think both of them are not, one is here. And then I will talk about her first. She is from NIMS, and she is the head of Jivandan program, which is also very actively involved in disease donor transplant program in the state. And because of her personal effort, of course, with contribution from all the hospital, Telangana has become #1 state in the whole country in the number of disease donor transplant. Earlier it was Tamil Nadu, but Telangana in the last year, if I am not wrong, I think has overtaken Tamil Nadu in the number of transplant, cadaver transplant and organ donation. I think that all credit goes to government of Telangana, the Minister of Health, and of course, the Jivandan organization. So she is going to give us little insight about how the transplant program was developed and how and what will be the future of this program. Because without a vibrant transplant program, definitely no transplant program can survive, whether it is kidney, liver, heart, lung. So we need a very, very active Jivandan program and hope that in the future we will get more number of donors from this particular organization. The second Sonlata, of course, is yet to come. She is a very renowned renal histopathologist from the country, I should say, because she has been working on renal histology for last almost maybe 25 years, and she is an authority on the subject. Same thing, we always see her report and talk to her about a particular patient. But today I called her to give her experience as a whole, what she has achieved or what is the contribution from both sides, from the nephrologist or transplant surgeon plus the pathologist, and how they have definitely both have improved the quality of service given to the patient, because the histology or the histopathology in the post-transplant is extremely important to diagnose a particular disease, and on the basis of that only we study the treatment. I think she will be talking on that subject. Dr. Anuradha is here, one of the senior nephrologists in the city. I told her to talk about the past, present, and the future, because many of you, they're only knowing what is the present and the future. The past, you may not be knowing because you were not there at that time. And only I think I can see Dr. Anuradha, Dr. Gopal Krishnan is there. Those are the two persons who will be really knowing what exactly has happened, because you started the program in Hyderabad way back in 1981, and now it is 2019. There's a huge gap in between. So what has happened, mostly Dr. Anuradha is going to tell us to some extent. And that way we have government representation, though he is a medical man. Dr. Gangadhar, he also will be coming anytime. So he will be talking about what is the role of the government in developing the transplant program in the country, in what way they can contribute. So these are some of the things that what we thought that we should also share with you. You also should know what exactly is happening. And that is what I said, that this session is a little different from a normal scientific session. At the end, I would like to again thank you all for sparing your time in this Sunday morning and coming to KIMS Hospital. And we all hope that you go back with some information, at least what you didn't have in all these years in your whole career. I also thank Dr. Gopal Krishnan, Dr. Bhaskar Rao also having coming here and graced this occasion. Thank you so much.